Basically, there's two lines of treating female pattern hair loss or that hormonal type of hair loss. And you're either using hormonal factors to implement it, so either promoting estrogen or decreasing testosterone, or you're going down that growth factor pathway.
Welcome to Thriving in Menopause, brought to you by Prevention Magazine. I'm Zoe Mernier, the editor of Prevention, and I'm thrilled to have you join me for episode 5 of series 12. Today we'll be discussing a topic that affects many women, 50% in fact, and can be very distressing for those involved, and that's hair loss during the menopausal period. To help us discuss exactly why it happens and what we can do about it, we're thrilled to be joined by Chelsea Salinger. Chelsea is the Executive Director of the International Association of Trichologists. She is also a consultant trichologist at the Australian Trichology Centre in Sydney and Adelaide, where she specialises in hair loss, baldness, alopecia and hair breakage. Chelsea, it's so lovely to have you join us today. Thanks for being here.
Thanks, Zoe.
Okay. All right. Well, let's start by letting us know what exactly happens to our hair during menopause. Tell us exactly how those pesky hormones come into play when it comes to hair.
Well, not everyone experiences hair loss or hair thinning in menopause, but a good number of women do. And what tends to happen at this time is our hormones shift in a really simplistic sense. If someone's going to experience female pattern hair loss, then as their estrogen levels come down, testosterone then has more influence on the hair. And if someone's inherited the sensitivity to the strong testosterone that's in the skin, which is called dihydrotestosterone, then slowly their hairs will begin to become finer in their diameter in this area on the top of the scalp. So that's one of the really common hair loss conditions that we can see in women as they're going through menopause, although menopausal women aren't the only people who could experience that type of hair thinning.
Yes, indeed.
That's a typical one. But also I like to make people aware of a newer type of hair loss, which I'm seeing a huge increase in, which is also more likely to occur in menopausal and postmenopausal women. And it's called frontal fibrosing alopecia. And the reason why it's so important that people are aware of it is that it's a scarring type of hair loss. So that means the hair follicles are destroyed. So it's irreversible. So the sooner that someone can realise if they have this problem, or that they realise, the better. It's often preceded with some loss of eyebrows, but not always. And then we'll have recession of the frontal hairline. And when it's been going on for a little while and the follicles have been destroyed, the person might even report that to the touch the skin feels really smooth, and that's a sign that the follicles have been destroyed. So it's really important if you think that that's going on that you get some help.
And so with the specific menopausal hair loss, is there a typical way in which it presents? You sort of said at the top of the head, so we're talking about like a widening of the part and sort of, fining at the temples, that kind of thing?
That's right. In female pattern hair loss, sometimes people report their parting becoming wider. It's because it's not actually the part that's becoming wider. The hairs are becoming finer. So visually, people think that their parting is getting further separated. At the temples is a common place to initially notice some thinning. Also at the crown, which is at the kind of top at the back of the scalp, is another place where you might notice thinning first. But anywhere that's on the top of the scalp, because that's the place where we have receptors for that DHT, dihydrotestosterone, if that looks thinner relative to the back down low, which has no receptors for DHT, then you know that it's hormonally related, mediated.
Yeah. So you talked about this other hair loss condition that is permanent. Now, is menopausal hair loss permanent, or is there a potential for regrowth here?
Definitely potential for regrowth. And especially it's a lot easier to treat when people think that something's going on and notice it early on.
Yeah.
So it most of the time is reversible. It's just a matter of finding the right treatment fit for someone.
Okay, so that obviously varies from person to person, I guess.
Yeah, some of them are hormonal treatments. So sometimes people might use a hormone replacement therapy or maybe a plant estrogen, maybe a natural DHT blocker. There's also evidence for things that promote growth. So basically there's two lines of treating female pattern hair loss or that hormonal type of hair loss. And you're either using hormonal factors to implement it, so either promoting estrogen or decreasing testosterone, or you're going down that growth factor pathway. And that's things like minoxidil, the medication, the low-level laser therapy, which looks like a hat or helmet, PRP, which you might have heard of, platelet-rich plasma, or even caffeine. Topical caffeine has some evidence too of helping to keep hair in the anagen phase. But there's these two broad things. Plus, in the middle, which nearly every person has with this type of hair loss, is what's called perifollicular inflammation, which is the inflammation around the hair follicles. It indicates that hair loss is happening. And so addressing that is always part of treatment as well and is really important.
Right. And how would you treat that specific area?
I normally utilize a particular amino acid, so something natural called L-tyrosine. Sometimes I'll use NAC, a different type of amino acid too. Ultimately, we're trying to reduce that inflammation. The L-tyrosine reduces the noradrenaline from the sympathetic nerves in the skin, which in turn reduces the inflammation there around the hair. NAC, N-acetylcysteine, is a really strong antioxidant, so reducing oxidative stress and cellular damage to reduce the inflammation.
Now, you mentioned this scarring type of condition. You said it's important to, if you see signs of this, seek treatment early. So if someone has this condition, how would you treat that, and can you stop it in its tracks, as it were?
Yes, so with frontal fibrosing alopecia, that scarring type of hair loss that tends to pop up around menopause, yes, especially when we realize sooner, we can halt it. That's ultimately the goal. First line is using vitamin D because there is a defect in the vitamin D receptor in this hair loss problem. So supplementing the appropriate dose of vitamin D to compensate for that is really, really important. Plus dealing with the inflammation. Then it seems like in this type of hair loss problem, people are actually more likely to have a little bit of an allergy or be sensitive to a certain type of fragrance. So I always talk to my patients about that and moving them towards more hypoallergenic products too, to help to prevent that allergic reaction and worsening of the hair loss. And then stress. Stress plays a really big role in this type of scarring loss. And so I talk to people about, trying to counteract the stress in their lives and committing, 10 minutes a day to relaxation or, mindfulness, because it can ultimately make a difference. The stress increases the noradrenaline, the stress signal from the nerves in the skin, which therefore increases the inflammation around the hair and worsens this hair loss. So if we can get them to come at it from all directions, we get a really good outcome with this. There are other treatments too. Sometimes people are going to use topical steroids or injected steroids in this problem too, or there's a medication that's sometimes used. But I've actually had great success initially just using the vitamin D, reducing the inflammation and being, I guess, holistic about it.
Okay, so how can our diet help support our hair health? Is it true there's a link between hair loss and low iron?
Yes, but more diffuse hair loss. Obviously, when it comes to like menopausal hair loss specifically, then that's relating to just one area, whereas a dietary insufficiency like iron, it's a very common one. I see it constantly in my clinic. That's going to affect the whole scalp. In a type of hair loss, diffuse hair loss, or telogen effluvium is the name for that. Telogen effluvium can be experienced by anyone at any age, but I think it is good to note that if you're experiencing hair loss and particularly fast shedding, then you should consider, has there been any element of stress that could have triggered that type of shedding hair loss, but also should you have a blood test done to rule out a nutritional deficiency or one of these key nutrients for hair sitting under the threshold for hair loss and causing the shedding. So the really common ones are iron, or the ferritin, which is the iron storage, vitamin D, so important for hair. We actually have receptors, vitamin D receptors inside our hair follicles. That's how important it is.
Okay.
It's a really, really common deficiency here in Australia. People are often surprised. B12 is another important one for the hair too, and zinc. They're all the kind of key nutrients for hair. Plus, if we're talking about that diffuse hair loss, then making sure thyroid is healthy and in range too is also important.
Yeah. So just going back to, you mentioned stress, looking at whether a stressful event happens. So let's talk about stress and how it impacts hair loss. I mean, because sadly a lot of menopausal women are pretty stressed. But yes, what takes place when you're stressed that causes this hair loss?
Well, it can be any kind of stress event. Normally, to trigger what's called acute telogen effluvium or a shedding event, it's normally a pretty significant stress. So we're not just talking low-grade day-to-day stress,
Yeah.
but we're talking, for example, someone is in a car accident or a family member, is gravely unwell. That sort of thing is enough of a shock to the body, or even like the stress. Another good example of stress is like an operation, the stress to the body of that operation. Then normally nothing happens to the hair for about 3 months. But what has actually happened, I guess, if we're thinking about the physiology, is that hairs jump from the anagen, which is the growing phase, prematurely into the telogen or the resting phase. And that resting phase lasts for about 3 months. So that's why hair, get the shock, hairs jump into telogen, but then seemingly on the outside, nothing kind of happens to the hair for this 3-month period, approximately. And then at the end of it, that's when the hair actually leaves the follicle and sheds. And so that's when people go, wow, I brushed past my car seat, hair's everywhere. I wash it, just so much more hair than normal. If that's occurring, probably it's not the genetic thinning or female pattern hair loss or hormonal hair loss. It's probably something else. This telogen effluvium. So it's worth looking into.
Worth tracking back 3 months to see what happened there, because I think a lot of people wouldn't make that connection given that time frame, because it's not happened immediately after it. Interesting. And how important is good sleep in supporting healthy hair through menopause?
It is important. I like to think of sleep, exercise, healthy diet, minimal alcohol, no smoking, drugs, etc. All those things that you and I think of as healthy lifestyle factors, they ultimately can change the epigenetics. So we're never going to change our genetics, but you can change epigenetics, which is the switching on or off of genes. And so in female pattern hair loss, or that hormonal hair loss, it seems that if you are doing all of these things that are maybe not so healthy, sleeping poorly, rubbish diet, super stressed out, etc., then you're more likely to switch on the genes for genetic thinning and experience this type of hair loss or experience it more severely. It seems like those epigenetics then sensitize the androgen, the male hormone receptors within the scalp. And so we want to manipulate those lifestyle things as best we can too, because ultimately that's going to lead to the best outcome for someone.
Absolutely. So when a patient would present to you with hormonal hair loss, what would be your port of call? Like how would you decide which treatment you're going to use and how would you go about treating someone?
Sure. So first thing, they come in, take their history, examine their hair and scalp under my microscope, really comparing the areas, on top, so front and center, at the temples, at the crown, with the back to determine, right, is this that hormonal hair loss or is it something else? And if I can see a big difference in that density, then I know, okay, clearly it's female pattern hair loss. Then with that patient, we'll discuss the ways of going about treating it. So first of all, those lifestyle things will be discussed and if they can make any tweaks there. Second of all, the inflammation, the perifollicular inflammation. I can see that when I look under the microscope. And so if that's there, then we're going to want to treat that, address that too. That's with either the antioxidant or the amino acid. And then there's all of these possibilities of how to then treat the hormonal or growth factors and those elements that we spoke about. And it really depends on if someone's taking other medications, are there contraindications, which means things that they can't take together with one another because they are an issue. And so discussing with someone, but it also depends on the severity of their hair loss too. If it's extremely mild, then that opens up really all of the available options to us. Maybe that person wants to do something topical and natural. So they might do something that's a topical caffeine, topical saw palmetto, for example. But, maybe if it's more severe, then we might be talking about some of the medications that can assist during this time.
Yeah. So yeah, going back to some of those, obviously there are a lot of products on the market, shampoos, scalp treatments to support hair loss. So how effective are some of those treatments? I mean, sorry,
Yeah,
I didn't say
I
that
see so
right.
many things marketed to people experiencing hair loss, and I feel really frustrated by some of them because I feel like they're taking advantage of people who are quite vulnerable. Anyone who's experiencing hair loss, it really worries them, and they are then a little bit more vulnerable to these sorts of advertisements that sometimes are not true. So, for example, hair loss shampoos. Ultimately, it doesn't matter because the topical treatments for this type of hair thinning, they only work whilst they're on. So how long is a shampoo touching your scalp for? Maybe 2 minutes. That's not enough treatment time. A treatment needs to be touching your scalp for 24 hours. So ultimately, I say to my patients, find a shampoo that feels good for you. Hopefully, it has a few antioxidants. So those tend to be those plant-based ingredients because that might help a little bit the inflammation, but it's not going to be the sole treatment. It just doesn't have the contact time. So use something that's maybe volumizing, but ultimately that's totally superficial. So shampoos and conditioners, no, not a treatment. Serums that are natural, it just depends. There is some evidence for some of the natural topical things, but again, these serums, creams, they have to stay on for 24 hours and you reapply every day. So like I said, evidence for caffeine, saw palmetto, red clover are the main, some copper peptides there's evidence for too. So those are probably the main natural ones. But again, sometimes brands are not very upfront with the strength, for example, of the caffeine. And so who knows what the strength is and if it's appropriate of what we've seen in the research for being effective for this type of hair loss. Then we have topically minoxidil. 5% is the correct strength for men and for women. Take note if you're looking at minoxidil, at the pharmacy, the men's is identical to the women's, yet women get charged more. So you can
Right.
certainly purchase the men's or just the generic 5%. So there's really strong evidence for topical minoxidil 5%. It's a really great treatment option.
Okay, great.
Yeah.
So yes, you mentioned platelet-rich plasma before. How does that fit into the treatment plan and what is involved in that process?
Platelet-rich plasma, PRP, is a process where a doctor or nurse, they draw your blood, they spin it, concentrating the platelets, which are rich in your growth factors, and then inject it into the scalp. So again, that's a growth factor pathway we were speaking about. It's either hormonal or it's growth factors when addressing this type of hair loss. Downside of it, it can be painful and it can be expensive. The interesting thing about it for the current evidence that we have is that the protocol really should be once a month for 3 months, goes 6 months a couple of times, 1 year, 2 years, eventually not at all. So it's interesting. It's the only treatment that has evidence that you can taper down and it seems to hold its benefit. Whereas every other treatment, because your hormones don't go away, they're all long-term treatments. If you found it helped, you have to keep doing it. So it's interesting with PRP that it's a little bit different, but it is newer. I think we're still finding our way with that a little bit.
Okay. So going back to these other treatments, in terms of is it in our best interest to try and kind of support our scalp health? Will that help, our hair become stronger by creating a healthy scalp environment?
Definitely, it seems like if someone has scalp microbiome dysbiosis, so an imbalance of the good guys and the bad guys that live on our scalp, bacteria, yeast, etc., it predisposes them to scalp problems, but also inflammation. And as we know, inflammation can worsen some types of hair loss. So keeping your scalp health in mind is important. I think if you're experiencing hair loss, the temptation for some people is to begin to then stretch out their hair washes because they don't like seeing hair loss, but please keep regular with your hair washing frequency. It helps you to maintain your scalp microbiome because often your shampoo will help to correct the pH on the scalp, keeping it a little bit acidic, which helps to prevent overgrowth of some of these bad yeasts and bacteria. So maintain hair washing frequency so you don't get that buildup of oil and then microbiome imbalance.
And what about sort of massaging or just stimulating the scalp in that way help stimulate hair follicles?
Yes, massage has evidence for this type of hair loss. I call it the one percenters. It's not ever going to be your sole treatment, but it definitely has evidence that can help a little bit. And I figure, why not? It's
Exactly.
inexpensive. You can do it yourself. And the reason why it can help is that it brings blood flow to the area and therefore greater nutrients to the hair.
And it feels nice too.
And it's relaxing. Maybe it's the stress element.
That's right. Now, you touched on this before. I mean, this can be very distressing for a lot of women. So how do you suggest that women can try and manage the emotional impact of their hair thinning?
Yeah, it is tricky, but I think keeping in mind that generally, if you're experiencing this type of hormonal hair loss, the hairs are being replaced, and it's also a slower type of hair loss. So to not panic, but also to know there's a lot of women who experience this. About 50% of women will experience this type of hair loss. So you're certainly not alone, but calmly taking action and doing your best to not let it become your sole focus and consume you, but keeping up with the other things that you have as interests and things that you enjoy.
Absolutely. Now, are there certain hairstyles or hair care routines that are actually harmful during this time that people should avoid?
It is important to be aware of a different type of hair loss called traction alopecia. And this type of hair loss, unfortunately, is a permanent type of hair loss. Again, it's a scarring type of hair loss. And it is caused by tight hairstyles worn for very long periods of time. Some examples are like a tight ballerina bun, or, with African hair, sometimes you see really tight braids. And those sort of hairstyles where the hair is being pulled at for long periods of time, yes, ultimately causes a lot of inflammation around the hair follicle, and it gets destroyed eventually. And so scarring loss, the hair can never return. The other thing to be aware of is sometimes when you're experiencing hair loss, people are tempted to then get hair extensions to make their hair feel more full. But unfortunately, again, I have seen terrible cases of traction alopecia because of the hair extensions worn for years and years and years. And again, it's because of the weight of that hair extension pulling down on the hair for years that it can cause this scarring loss. So my preference, if someone is looking at some kind of hair addition, hair piece, rather than choosing something that's going to add weight and pull down against your hair, to look more towards toppers, because gravity helps to keep it on and give you that fullness. So that's the better way to go if you're thinking of something like that.
Okay, fair enough. And what about, say, bleaching hair or colouring hair? Is that damaging? I mean, we know it damages hair to a degree, especially at the bottom, but does it exacerbate this problem?
Not really. No, people can feel free to colour their hair as per normal. If it's never been an issue for them before, it's not going to suddenly be an issue too. Yes, it causes damage more to the hair shaft. It's nothing to do with the hair loss itself.
Okay, well, that's one good thing then. That's so interesting. Now, if someone is looking to seek treatment from a specialist or a trichologist, what should someone look for? Are all trichologists created equal? How should they safeguard themselves when they're looking for some help?
Great question. Yes, look for a certified trichologist who's registered with the International Association of Trichologists. This means that they're held, accountable to maintain their knowledge. They're always doing professional development, so they're staying up to date with the latest, research and evidence, but also that they have that level of accountability to the association that if there was a problem, they're practicing by a code of ethics. And if they were to break that code of ethics, then there are ultimately consequences for that. So looking for someone who is registered is really important. So you can find them on the website www.iattrichology.com under the Locate a Trichologist page.
Okay, that's Thank you so much. That's very helpful information. Well, look, unfortunately, that is all we have time for today, but that was incredible. So much great information there that I think will be really helpful for women going through this. So, Chelsea, thank you so much for joining us today.
Thanks, Zoe.
And readers, thank you for joining us as well. If you enjoyed today's episode, we'd love you to rate, review, and subscribe. And don't forget to pick up a copy of Prevention Magazine. I'm Zoe Mernier. See you next time.